with the optics, and the best optics can come from the Hoya itself. And we have now so many other designs giving us a good results. Yeah, Arun, he's ready now.
Yeah.
Arun is a professor. He just, completed his tenure in PGI Chandigarh. Now he's working in a different institution, has done a great work in this field, and his experience will really count. Dr. Arun, please.
Okay, thank you, Dr. Titya. And at the very outset, I'll thank the organizers for giving me this opportunity. Today, I'm going to talk about this Vivinex platform, how this Vivinex aspheric design help in improving the post-operative image quality in our patients. I have no financial interest in the subject matter of this talk. So first of all, let us know what is this Vivinex platform. It has a proprietary aspheric optic design to which I will come later on. And in addition to that, it has a new glistening-free material, new delivery system which is excellent, and also it has a PCO prevention mechanism. There are so many attributes to this. And before I go into this proprietary aspheric optic design, as all of us know that these higher order aberrations accounts for 10 to 20% of optical defects. As of now, we are in most of the IOL, we are addressing only the spherical aberration. We don't never talk about how we can counteract this coma aberration in this patient. These are the two most common aberration which accounts for 10 to 20% of optical defects. And the impact of these two aberration is quite a lot on the quality of vision, which is almost equivalent to last two lines. In terms of higher order aberration, it is around 0.25 micron of higher order aberration is equivalent to around 0.2 diopters in terms of spherical error, which is equivalent to last two lines in the Snellen chart. So this has quite a bit of effect on the quality of vision as far as quality of vision is concerned. In a perfect eye, you get a point spread function, but if you have coma or spherical aberration, you get a spread out of the point spread function. And in our eye, because the position of the eye and the tilt in the optical axis, we have naturally occurring coma aberration, which could be vertical or horizontal. And as far as also this corneal coma is compensated by also the decentration and tilt of our human crystalline lens. But as we age, the internal optics of the lens also changes, and cataract surgery gives us opportunity to manage these spherical aberrations. Corneal aberration, as we all know, is to the tune of 0.2 to 0.3 plus micron. And aspherical IOLs are designed to improve the image quality. And however, again, I said that effect of coma on image quality is not routinely addressed or considered. And this is the two eye of the same patient. In my eye is aspheric IOL, in other eye is the spherical IOL. You can see the point spread function with aspheric IOL, and the sterile ratio is very close to 1. So addressing the spherical aberration improves the quality of vision. But again, coming to after doing the cataract surgery, the causes of coma aberration still remain in the eye. And even if you implant aspherical IOLs which are not addressing this coma aberration, you will have deterioration of quality of vision in case the decentration of IOLs happen. So we should be considering this aberration also while doing a cataract surgery. As you can see, as there is a decentration of, and this is more so in aspheric IOL. Once aspheric IOLs decenter, the effect on quality of vision is much more. As you can see in aspheric IOL compared to spherical IOL, deterioration of quality of vision as there is a decentration of the IOL. Same is true about the tilt of the IOL also. So what is this Hoya platform special aspheric optic design? It neutralizes the corneal positive spherical aberration to some extent. It also tolerates the anatomical misalignment as we have in our normal human eye, and it also compensates for coma aberration. So what is this patented optic design? So in the central 1.2 and area 1.2 surrounding this area, we have a slight area of positive asphericity, then a slight area of 1.2 millimeter diameter of negative asphericity, and then there is a continuous zone of negative asphericity. What this does is, the first element, it produces a typical plus coma of when there is a decentration of the lens, and the second element, it produces equal and opposite coma when the lens is off the axis. So once there is a decentration of the lens, it compensates for the coma like a normal human crystalline lens. So is there any evidence to this with this lens? This was the study conducted by Pablo. This was an experiment study in vivo, and they have shown, they compared 3 IOLs, the Vivinex, the Technis, and the third one, the IQ Alcon. And they found that this Hoya Vivinex platform was most immune to optical degradation caused by the decentration of the lens. So, but this was a bench-side study. So, and this was shown that reduced coma was caused by off-axis alignment of this lens. This was again in lab, and it was shown that in the presence of decentration of Vivinex, as the decentration increased, the visual Snell ratio was much better maintained with Hoya Vivinex lens as compared to the other 2 lenses. So this was, so do we have a clinical evidence of this? Because in lab, everything is aligned on the optical axis, but human eye is not a perfect eye. It only works at 40% efficiency. So there is a misalignment of geometric optical axis and a misalignment of visual axis. So to prove this, we did 2 studies. In first study, we was published in 2022, where we compared Vivinex with the Alcon IQ lens, and the second study published this year only, 2 months back, where we compared this lens with the Technis lens. So let us see what were the results. So this was done 4 years back, and in this we randomly allocated one eye of each patient to either of the lens, IQ or the Hoya Vivinex, and patient underwent surgery, and after 3 weeks of surgery, we did all these tests, contrast sensitivity, and we did a eye trace evaluation to calculate the decentration of the IOL, as well as higher order aberration, and as well as we noted the Snell ratio in these patients. So this is one case with the dilatation of pupil. You can see the yellow one is the point of the center of the lens, blue is the geometric center, red is the optical axis. So on the eye trace, you can measure the decentration of the lens from the optical axis as well as from the geometric axis. This is a centered lens, but this is a decentered lens. As you can see in this case, the decentration is around 0.66 millimeters. So this was done in all the cases, and higher order aberrations were noted in all the cases. And what we found was, with increasing angle alpha, there was a deterioration of Snell ratio in the IQ lens, but not in the Hoya Vivinex lens. And evaluation of total higher order aberrations, coma, trefoil, and spherical aberration showed that in Hoya Vivinex lens, with increase in angle alpha, there is a negative correlation with the higher order aberration. This doesn't hold true for IQ lens. This is apparent in this graphical form. This is with the increase in angle alpha along the x-axis, and we compared the Snell ratio, higher order aberration, and spherical aberration. As you can see, as the angle alpha increases, we have a maintenance of Snell ratio, whereas in IQ lens it goes down. Similarly, the relation is negative with the spherical aberration as well as higher order aberration. So we concluded from this study that in vivo, the geometric axis and visual axis do not coincide. Hence, the result may vary from simulated trials like we have done in vivo study. So decentration of the lens is best measured with the respect to the visual axis. All of us knows that all the ablation procedure or optical devices should be centered onto the vertex of the cornea. And in eyes with large angle alpha, the aspheric balance curve design performs better by inducing lesser higher order aberration and maintaining a better Strehel ratio. So the outcome of this current study have demonstrated that statistically better parameters, no deterioration of Strehel ratio with increasing alpha in Vivinex group, which appears to suggest that in such situation where the angle alpha is more or there is chances of decentration of the lens, like in subluxury lens or weak zonules, one can choose this lens to have a better tolerance to the decentration of the lens in terms of quality of vision. So this second study was comparing this lens Vivinex platform with the Technis lens. So again here we studied the decentration of this lens in one eye. This is a contralateral eye study. One eye we put one lens, in another eye the other type of lens. It was randomized, and the results were again the visual internal Strehel ratio was higher, statistically higher at all pupil sizes, and the spherical aberration value were lower at all pupil sizes in the Vivinex group. Though the decentration of the Vivinex IOL was more as compared to the Technis lens, still the quality of vision was better in Vivinex platform. With an increase in angle alpha, there was a greater decline in visual Strehel ratio for Technis. However, there was a statistically significant decline at 3 millimeter, non-statistical significant decline at 3 millimeter pupil size for Technis lens. So this shows that the spherical aberration were statistically less in Vivinex group as compared to the Technis group at 5 millimeter pupil size, and this shows at all the pupillary diameter there was a statistically significant difference in the Strehel ratio, and the Vivinex group always had a better Strehel ratio at all the pupillary distance, though it was not statistically significant at 3 millimeter. At all other pupillary diameter it was statistically significant. So again it shows the same trend. The visual Strehel is better with Vivinex. It's maintained better as the angle alpha increases, but there is steep decline in the other IOL. Again, Technis has a much higher asphericity. Higher is the asphericity, it is more known that more is the deterioration of vision with the decentration of the lenses. So similarly, a higher order aberration and spherical aberration showed a better result in a Vivinex platform. So the conclusion of this study was, in comparison to an anterior aspheric design IOL, which is Technis, the ABC design or the patented optic design of the Vivinex platform, it yielded better quality of vision, neutralized spherical aberration to a large extent, and provided a relatively superior quality of vision with decentration. So to summarize, now all the Hoya these IOL, be it Vivinex, be it Geometric, be it Hoya Impress, all are having the same platform with the same optic design. So to summarize, this unique negative aspheric lens platform of Vivinex is less sensitive to alignment than traditional negative aspheric optics lens. This combines the benefit of traditional negative aspheric optics with that of a neutral aspheric. Like in neutral aspheric, decentration doesn't lead to deterioration of quality of vision. And the visual axis compensation as happen in natural eye benefits, since visual axis doesn't typically coincide with the IOL optic center. So this patented proprietary aspheric optic design reduces the coma that is typically induced by decentration or tilt of the traditional negative aspheric optics and improves the quality of vision in terms of maintaining internal stereo ratio. Thank you so much.
Thank you, sir, for that wonderful highlight of that ABC design. I'll request Dr. Ramamurthy to please be on the chair. Welcome, Dr. Namrata Sharma, ma'am, Chairman Scientific Committee. So just two quick questions. I mean, I just noted that you highlighted that negative correlation with the Strel ratio. So, I mean, how do you account that? The more decentration and why the Strel ratio was increasing despite the lens getting more decentered?
So, as we discuss in the optics of this design, as it decenter, it negates the comma aberrations. So by negating the comma aberration, it improves in terms of, that's what
I mean, that was a quite
contemplating.
Interesting observation.
There could be so many other factors, but one of the main factors, because comma and the spherical aberration, these are only two aberrations which affects the central part of the vision. Rest of all aberrations are affecting the peripheral part of the vision, which comes into play in mesopic and scotopic condition. Spherical and comma aberration comes into play even in photopic vision.
Just a second quick question. Do you then recommend that this becomes a universal IOL to be implanted in people who do not have an access to an eye tracy? This becomes a very forgiving lens when you have a large angle alpha. So I think with this ABC proprietary design and this Vivinex then should become one of the the mainstay of monofocal IOL implantation technology.
Yeah, I think so, but if you really want to customize IOL implantation, then ideally one should be measuring the spherical aberration also in each patient, because in normal population there is a variation of spherical aberration, corneal positive spherical aberration from 0.1 micron to 0.4 micron. So you have to choose a IOL also so that you also leave behind some residual positive or negative spherical aberration to the tune of 0.1. There are enough number of studies, because otherwise you will have a very flat pinpoint sort of point of focus, and the depth of